Okay, good morning. What is today? Kidding. It's Wednesday, and we're very excited for you to join. And as people finish their coffee and start to come in, we're excited for you to join our CPT build. So, what is CPT build? It is our Christian professional Tampa professional build where we bring in clients that and customers. Sorry, I think I need a little bit more of the coffee here. Where we bring in amazing companies that have very unique offerings. So I'm very excited to bring in AHCN America for you to learn from our guests, Rick Granite and Larry J. Williams. So let me bring them on stage and let's just get right to it because I know you will want to learn about them. So let me do this. All right. So Rick Granite, welcome this morning to CPT Build. And Larry, welcome.
Welcome. Thank you. Nice to see you both.
Nice to see you guys.
I'm very excited for people to learn about you. Larry, I've known you now a couple months, and the first time that we met, you told me about what AHCN does. I was knocked out. So I'm very excited that you guys are our guests, and please tell the world and tell our professionals here about AHCN.
I'll start. And again, my name is Larry Williams, and with me today is my colleague, Rick Granite. And we are here today to introduce you to and to open your eyes and tell you about a new healthcare dilemma that we have developed in our company, AHCNamerica.com, if you want to look at the website. And what we have done, and both of us and everybody in our organization have been healthcare providers for many years. And we've simply put together a plan whereby the public, the consumer, the patient, whatever you'd like to call it, and the providers we have developed a new way to provide healthcare services that is inexpensive and is affordable. We have a slogan. It's called Your Health, Your Choice, and Your Money. And what we've really done is developed a program where healthcare is simple and can be understood. We have gathered facts for almost 7 years and put the program together. We are, again, a network. So our goal is to provide an advocacy for the consumer/patient. Physicians, very important with physicians and suppliers that supply medical services. So with that being said, again, we feel like we have made healthcare simple and understandable. So if I go through some of our information here, you see here a PowerPoint that we'll run through fairly quickly. But, and the benefits, we call it benefits. Really what it is, it's an advocacy program. But anyway, we've found a way to give people complete access to almost all medical services where you can shop online, pay in advance, and it's a cash-based scenario, and the prices are significantly discounted. One of the problems in healthcare is no one can understand when they use their healthcare how it works, and the fact that they get bills after the fact and then have to go through the scenario. We've eliminated all of that. So the next slide is, what does AHCN do? Again, I've already said we've tried to make healthcare simple. You see up there in the first paragraph. And our targets are obviously the consumer, physicians, people providing medical services. And when you take that into account, let me tell you what we've eliminated, because I hated this in our diagnostic imaging business for years, and so did Rick in the lab. And so if you had surgeries too. So for example, your doctor sees you in the office, and I'll use an example as an orthopedic only because I'm familiar with that. And orthopedic sees you in the office. He has to get an MRI for you. You wait a week for him to do it. His office staff has to get an authorization. He comes back and the results are that you need a surgery. So the staff has to go back and get authorizations again. And so what we've done is we've eliminated all of that because we are not insurance. We're better than insurance. So what we've done for a patient consumer, uh, there's no billing and collections, there's no copays, there's no deductibles, and there's no conditions for pre-existing conditions. So if you're a consumer physician or a medical provider, we have made that simple. And what we've done is taken the process from an administrative standpoint and eliminated the administrative functions to make it easy for you, and we pass that savings on to you. You will discover that all of our prices are significantly discounted, and again, you see them transparently posted online, so you know what you're going to spend before you spend it. As everyone knows, there's been some dramatic shifts in healthcare, and what is really headed to the future and beginning very strongly now is that healthcare is becoming a consumer-based product. You know, you shop for everything else online, you do, but why can't you shop for your healthcare and know what the cost is going to be for the money that you're going to spend? Now, our product is broken into 4 categories, and the 4 categories that we service or that is our target service is the uninsured, people with deductibles at $5,000 or above, certainly self-insured and self-funded businesses. And the reason is because we can dramatically reduce their costs in what they're doing and still provide a good product to the patient or the consumer. Next, you'll see I call it a wheel, and up there you go. Those are the products that we have in place as we speak. You'll also see down in the right corner where it says nationwide services. Of all the services listed there, most all of our services can be performed nationwide tomorrow. So that's a gigantic advantage for a person living in Texas or wherever. The next page that I'd like to share with you is, and you'll look at the bottom right there in red, what we've done. So many employers are having trouble retaining people. And an employer, due to the cost of healthcare, simply cannot afford healthcare and for some of their employees. Thereby, people are working part-time when they could be working full-time. And so we've addressed that. So we think our goal is not only the consumer, the patient, but also employers. This is particularly true in the hospitality industry and the real estate industry, where so many people actually have to get health insurance on their own. So we believe that's a tremendous market, and we know that that's something that we can service and do immediately. Would you go one more? This is a comparison sheet, as you can well see. And on the left, you see traditional health insurance. Traditional health insurance, and this is very important, costs the employer or yourself, if you're insuring yourself or your family, cost about $8,000 a year. So many employers share that cost, $4,000 for you, and they should do $4,000. And the problem is, even at $4,000 a year, people can't afford it. So what we have done, we have an annual program that costs $470, which gives you access to all of the medical providers that you previously saw on what I call the bubble chart. And if you go down to the bottom right, this is a very important issue that we've developed with AHCN. If you have traditional insurance, you have an enrollment period once a year. It varies to what month. So you're an employer and or an individual. And if you go down to the right column, you can enroll with us any time of the year. In addition to being able to enroll anytime, there are no pre-existing conditions for you to enter our program, and that's there's no social security number required. So all of these things are requirements for your traditional insurance, and you can enroll anytime. Next page is where you see some of the cost of newspaper and information that's been gathered from the Wall Street Journal that tells you about the rising cost of healthcare costs. That's a real number. The next page is the next slide is a very important slide. And what it does is it does a comparison if you're a company of 100 employees of what you are paying, because not all of the 100 employees are going to take the insurance. Recall that it's too expensive. So we have the alternative, and you can actually see the numbers there. I have to do that. That's a dramatic change in what you do. The final thing we have is we have a membership rewards program. And what is membership rewards? We know that there is a gigantic need for this. In Florida, that's 52% of the population, or about 11.5 million people that can use what we've developed here. So we've made it pretty easy where we can help you with a health savings account. But one of the new things we add is we have a donation page. So you as a person can be a part-time salesperson and gain a commission or an incentive, and you can redirect that money for your membership to put in an HSA account or any type of charity you may have or be interested in. So what I want to do right now, I want to turn it over to Rick, and I want Rick to show you how easy it is. Now, if you go back to our bubble graphs, one of our main products is a Walmart product that has two programs. It has a urgent care, which means in most cases you go online if you're a member and you turn around and you push urgent care at Walmart, and you're probably going to talk to a doctor in less than 15 minutes. The other program that we have through Walmart is a primary care concierge, we kind of call it, because it gives you the ability to go online and choose a Walmart doctor. You can see them there. They have their resume, so you can choose who you like. And what you do then is you set up an appointment, just like you would do with your regular doctor, except the fact that there is no bricks and mortar. So you don't wait in a waiting room with other people coughing. You don't go up for a 9 o'clock appointment and get seen by the doctor at 10:15. And you schedule your appointment on time. You make a call-in time that you designated with the physician that's going to be your doctor. And that's it. So what I'd like to do now is I'd like to have Rick demonstrate to you how easy it is to get access to a physician, because the main thing is still the physician-patient or consumer relationship. So Rick, if you'll take the handle now and go.
Sure. Thanks, Larry. As Larry said, we've focused on several key areas. I'm going to show you a couple of those. The first one, as Larry was just talking about, is our affiliation with Walmart Health. So essentially you log in. There's my login. And once you're a member, this is your dashboard page, or at least one of the main pages. So all you do is you click on your telemedicine, and it works through a service provider that we work with. And all of a sudden, you're at the Walmart Health. It's just that quickly. It says, "Good morning, Richard." It already knows who I am. And it pretty much just says, "Would you like to request a visit?" As Larry said, we've got urgent care. Let's say it's in the middle of the night and somebody's sick and you need to speak to someone quickly. It's literally just a click of the button, and you're scheduled and having that. We had a member recently. It was, I think, 3 a.m, and one of the kids were sick. They actually had the visit, and the person called in the medication, and they were able to pick it up right when the pharmacy opened. Had they had to go traditional, either go to an urgent care center or whatever, it would have been much more complex. And then you also have the primary care. As Larry said, you can select your primary care physician. The great thing about primary care is it allows for a much more comprehensive ability to take ancillary services like wellness, lab tests for your annual physical. They are able to write script for imaging, and you can pick them. Now, obviously, since it is primary care, it's a scheduled appointment, but it's much quicker. If you've had, like I've had in the past, you try to get in to see your current primary care, it may be months. So it's a lot more. And I think with COVID, people got a lot more used to utilizing a telemedicine feature, and it's just so much easier, and you can still have a wonderful encounter with your primary care and just do it through video or telephone. So this is one of the key things we have. The other one is we've got services. We've got a great pharmacy product. Overall, in the area of generic medication, there's not a lot of differences between the different plans. But when you get into the name brand drugs, those ones that you see all the commercials on, they're incredibly expensive. And through our provider, our members are seeing significant savings. Here's a couple of the examples of different drugs, such as Enbrel. You can see the difference in savings. Xarelto, Januvia. So all these are real savings that our patients are able to see, or our members. We even have some Medicare members who fall in the donut hole, and they're able to get significant savings while they're in that space where they're having to pay all that on their own. We also have lab. We have both wellness lab tests for our members, as well as if you have a prescription, you just click here and you upload it. We would price it out. We send you a invoice. You pay the invoice, and it gives you the order that you can take to a LabCorp location, and you don't pay anything there. You've already paid for it, and you're able to get the results. Very similar. We've got radiology, and there's radiology is one of the biggest areas that people are not price conscious of, and there's such a wide spread of costs in this area, especially at hospital level imaging. So through our affiliations, we've been able to really get a great savings, and it's a very similar thing. You upload your prescription, someone will reach out to you and clarify your order, and then get you scheduled so that you can go to get that done. That's pretty much it. It's a very easy website to use and access those services.
The other thing I think I mentioned briefly, but and don't let me forget somewhere in this presentation to thank you, Lisa, for putting this together for us and the CPT Bill Group. And we thank you very much for that. That's been very good. So the last thing that I think I'd like to mention, and I did mention it previously, we have what's called patient advocacy, which is a dynamite program and is difficult to explain. But let me give you a couple highlights. One, if you have been in the hospital and out and you're now back home doing well, you get your bill and then you feel like you got to go back to the intensive care unit at the hospital because your bill doesn't coincide and your insurance didn't cover this, and an aspirin is $25, and all of the things that drive people nuts. We have part of our advocacy program. We have a company that's an affiliate of ours that will guide you through that and actually help you recover your money. The other thing that I'd like to mention is our outpatient surgery type program. There is so much, I'm trying to think of a politically correct word. Maybe I don't have it. I'll say fluff of what's going on. We have, through our experience in healthcare for as long as we have learned to decipher what an appropriate fee would be for a number of things. Recently, we had a patient that had to have a total hip operation, had no insurance, 46 years old. He called two orthopedic groups in the Tampa, St. Petersburg area. One quote was $45,000. The other one was $35,000. He came and joined a network, and we got his rate, and I think he paid $19,000 or $16,000. I'm not sure, but anyway, you can see the dramatic things that do. And so anyway, we have thought about everything, and I'll leave one analogy for everybody. We're kind of like when we were all young people. Lisa, you already are. I mean, you still are. So, but for Rick and I, when we grew up in our hometowns, if you got sick, you went to the doctor. If you went to the hospital was able to provide all those services through their ancillary services. That's basically kind of what we've done with the network being in the middle. And then when you saw the bubble hub that we referred to earlier, those are the other services we have. So if you're going to have an outpatient total knee operation or anything like that, we can advise you through the advocacy group of what the appropriate amount of money you should be charged. This is done with nurses and some nurse practitioners that provide information that we have gained through us being in the healthcare business for so long. So we think that we have something, we don't think, we know, we have something very unique that can change the complex of how you deal with medical services. And it's kind of like the commercial on TV that the goofy guy in the yellow suit that has, I don't know what that animal is all the time, but it has a slogan of only pay for what you need. Our slogan is somewhat similar, or a catchword, only pay for what you need when you need it. And we are revolutionizing what we're doing in the medical field. And we think we got something that a lot of people can utilize and save a lot of money and still get high quality medical care.
You absolutely do, Larry and Rick. Thank you for your presentation. In fact, like you said, revolutionize the industry. And that's part of what we do at CPT Build. We only bring companies in that professionals need to know about. Now, I do have a couple questions. We have a little bit of time here. But I do want to say, did you say the percentage was 52% of Floridians need healthcare or using healthcare?
Fall into the program that we developed. And again, that's people with no insurance. That's people with insurance but have a high deductible, $5,000 or above, and certainly self-insured and self-funded businesses. Those four categories. And so that's 11 million people plus that could use our service. So it's a very big deal for us to get this off the ground big time.
That actually was part of the question, was to define who do you serve, which you just explained that. The other question has to do with, remind us again about the annual program, because it seems like a super low cost, and then you're a part of AHCN America. Can you just explain that one more time?
Rick,
please?
Go ahead and take that.
Sure. So with employers, we offer direct to consumer, and we've got a couple different options. But for employers, we allow them to work on an annual basis in order to get the savings, but pay monthly, because in many cases, your employees, for whatever reason, may come or go. You add employees, and so and they may go away. So we set it up very similar to maybe other benefits that you might be used to with your company. And we would collect those on a monthly basis from a census. So once once you're uploaded into our system, literally immediately your people have access to all the services, because we built API interconnections, and it really allows for immediate access. And then we true up at the end of each month based on that. One of the things that is interesting is if you have, let's say you have enough employees that you have to offer insurance, or you're just wanting to offer insurance. And as Larry mentioned, the cost is pretty high. And unless you're paying 100% of it, many times your employees just can't afford to take it. So yes, you offered it, but then they don't take it. So then they're kind of just left out. This is a great way to kind of offer a benefit to your employees as an employee retention, and do it in a very cost-effective manner. So we're not suggesting that you don't offer insurance, or we're not suggesting that people don't take insurance, but they can possibly buy a different level of insurance and then utilize our services as kind of a great way to marry those two up.
Rick, I love that you answered that question that way. I had actually not remembered for a moment the benefits to a small business owner. Our company is, we hover around 10 to 11. So we're a small business at Now Publishing, but that, especially in this work market right now, or labor market, job market, economy, right? It's how can you provide benefits to people that are on your team? And I'd forgotten the excellent benefit of AHCN being able to provide that. So thank you for bringing that up. The fastest growing market is SMB. We're ending our time here. But I wrote some notes here, no deductible, cash-based healthcare, no issues with predisposed, or what is it? Medical condition.
Pre-existing conditions. Yeah.
Pre-existing.
Thank you.
Let me
say
one thing before we close.
Go ahead. Yes.
I don't know if I said this when I was talking. The cost of a single employee to be insured through your employer or on your own is $8,000. If you add your family, which most employers do not include, it is about $23,000 to $25,000 a year for a spouse and a child. Mm-hmm. So you have $8,000 possibly shared with your employee if they share. If not, and you're on your own, it's $8,000. If you're insuring your family, it's $23,000 to $25,000. Healthcare is unaffordable in the market that we have right now.
Thank you. Sorry about that. I was thinking there was maybe a comma and you would tell us something else fantastic about your company. So you guys, Rick Granite, Larry J. Williams, thank you so much for sharing just a little bit about the various services and how you really are changing the landscape. So thank you for sharing with us. And I hope everyone digs in a little bit more on AHCN America to understand how this company can help you, can help your employer, can help your employees, and really can benefit us all, especially in this increasing difficulties of the economy, which I know is going to change. So it's going to get positive. So thank you, everyone.
Thank
you so much.
Lisa.
Thanks you, Lisa.
Thank you.
Thanks
You're
again.
welcome.
Bye-bye.
Thank you.
Bye.